Okay, I'm also.
Welcome to Health Talk Live Talk Show. Friends, as we all know, health is wealth and precaution is better than cure. My co host today is Dr. M.S. Kanwar. He's pulmonary and critical care specialist from Indraprasth Hospital, one of the best hospitals in India. Welcome to the show, Dr. Kanwar.
Hi, Rashmi. Thank you so much.
How are you, Dr. Kanwar? Nice to see you.
Yeah, it's been a little, far and in between because I was also away to UK.
Yeah,
We did program from there also,
yeah.
but it became a little irregular. But I'm fine. Yes.
Thank you so much. Our viewers have been missing you a lot and they were asking what happened. We are waiting for more and more information, and you have always been guiding them so well. So, thank you so much. So, let's invite our guest for today, Dr. Cover.
Yeah. Okay. The guest today is my dear friend, my colleague, Dr. Yash Gulati. Dr. Yash Gulati is a senior orthopedic surgeon in our hospital at Indraprasth Apollo Hospital. And he's been a decorated guy with Padam Shri and BC Roy Awardee, and he's been connected with Indian cricket also. And he used to get passes for cricket matches,
Okay.
and we used to envy him because he was the consultant in sports injury.
Wow.
So he would get the VIP pass, and those kind of things. And but he is a very good surgeon, and he has done some original work also. We'll talk about that. In fact, he showed me how he does the half knee transplant, half knee replacement, sorry, half knee replacement, how he does it, and he'll explain that to you later. But I think we should start with something which is very common at all age groups. In fact, even in young individuals who are in their 20s and 30s, low backache is such a common problem all over the world. And probably it has been exaggerated by the way people had to do long sitting hours during COVID times with work from home culture being enforced on everybody. And it's continuing like that in a lot of countries, including India. Dr. Gulati, what is your take on the low backache situation, which might be aggravating in a lot of such individuals?
There is no doubt that because of increased sitting at home, not having mobility outside, back pain, and in fact, aches and pains all over the body, pain in the neck and other places, has been the incidence has increased tremendously. Like in medical school, I always like to start to understand why this happens. And so, for that, I've got a model for you here, if you allow me to show.
Yeah, sure.
This is the model of a spine. Okay, there are these bones, the vertebrae,
Mhm.
then there are the discs in between, and then you have all the muscles around it, and there are nerves coming from here, and there are lots of structures in front of the spine, and there are some structures behind.
Mhm.
So anything going wrong with any one of them can cause back pain. So it is almost like Sherlock Holmes sometimes to find out the real cause of back pain. But common thing, common first. There are muscles which can get fatigued. There are ligaments which join different bones together. They can get stretched or fatigued or ruptured. And of course, everybody would have heard the term slip disc.
Yeah.
So, disc is nothing but a structure, a soft structure between two bones, a vertebral bone, acts like a spring, a shock absorber, and sometimes it ruptures and comes to lie on the nerve, and the pain starts going down the leg
Oh.
or in the arm in the case of neck. So this is the background. Now, the scientific fact, the science behind this is that every time we bend forwards, if we pick up 5 kilo weight, it multiplies by 10, and then it multiplies by the weight of the upper torso of the body, which is about 35, 40, Every time you try to lift 5 kg of weight bending forward, it actually translates into 570 kilos of weight on the spine in the lower back. And another scientific fact is that the stress on the spine or the disc is more when you sit than when you stand. Now, people would be
Oh.
surprised to hear that, but that is a fact. That is the reason why people who are sitting at home or have to work sitting all day long, white collar job, people who work on computers, people who are not, doing exercises, not keeping fit, they have greater incidence of back pain than other people. A very interesting fact that manual laborer working on the roadside have less incidence of back pain compared to white collar worker. That in itself will answer the question why people had greater incidence of back and neck pain when they were working from home. So it is no surprise because there is a science behind it.
Yeah.
Wow, that's
Well,
amazing.
you have so explained it so nicely. I'll ask my children, especially my son, who does a lot of sitting hours, especially in the COVID times, to actually go through your interview and try to understand, what goes wrong. Though in my terms, lay terms, I'm a layman, Yash, when I talk about spine, but I have explained to him, what he could land into. Anyway, can bad posture, now this is the sitting posture. Within that sitting posture, can a bad posture be contributing more towards
Sure.
these illnesses?
Look, again, I will again come back to the spine. See, spine, if you look from the front, if you look at front, is almost like a straight line. Now you look at it from the side, it's not a straight line. See, there is a curve like
Yeah.
this here, there is a curve here, and another curve in the neck. That is to give you flexibility, that is to bring your line of weight bearing in a particular line. Now, if this curve gets spoiled, for example, now you are seeing this curve here. Now, if the curve was to become something like this,
Hmm.
you can see all the structure would get stretched. That will cause chronic pain if this was to become a habit. Therefore, sitting in a chair or sitting wherever in a sofa or wherever, these sofas are the biggest culprit. They are soft, they sink, the huge gap between the thigh and the leg, and that creates bad posture in the back. So this is the biggest culprit. Similarly, working in the office, white collar workers, computers always turning side, or computer not being on the right height,
Hmm.
this causes strain to the ligaments and muscle. Again, another thing is that many places these furnitures are not ergonomically designed. Now, if somebody is 5'4" and there's another guy who's 6'4", how can you have the same chair
Yeah.
and table in the office? But
Correct.
that is the fact of life. Most of the places, these tables and chairs are the same height. You may be able to adjust a little bit. I often tell people, look, you may have to work in this office for 25, 30 years. So it is worth spending a little bit of money on your chair where you're going to sit every day. Dr. Kanwar, you might have visited my room, my office in the hospital. You have seen my chair. I have designed it myself. You have seen my table. It's different from the rest of the hospital. I have designed it to my height. So this ergonomical, you get a lot of fancy furniture. All these, it bends here and there and this push, they're no good. What you need is chair and table designed to your height.
Hmm.
When you sit in the chair, the thigh should cover the sitting area. The knee level should be such that it is at the level of the hip or a little higher. The feet should be resting comfortably on the floor. And when they are resting comfortably on the floor, the knee should be at the same height as hip. Similarly, your seat should not sink too much. Your back should support the small of the back. So these things, and you get all those executive chairs with a huge big back. And what happens? You're sitting there, you come sit straight in the morning, and by the evening you find most people are slouching. Their
Yeah.
their bums have slipped forwards, and the whole posture of the back and neck has gone haywire. That's a very important cause of back pain. The chair back should not be very comfortable in the back where you can keep slouching. It
Yeah.
should be something that you are aware of. So this is very, very important that the furniture should be ergonomically designed, even in an office. Ergonomics is not only for factories and for blue collar workers, it's also for white collar workers, especially people who are working on computers, who are sitting day in and day out. Is very, very important.
Thank you. Thank you. While you were giving these instructions about the height and all that, I was checking while sitting in my chair. I was
Of course,
checking
everybody will become conscious listening to these talks.
I don't know
whether
if you can
my
see
knees.
my chair. Dr. Kaval, I don't know whether you'll be able to see my chair. Look, I have designed this chair. I play saxophone, so I have designed this chair for saxophone. Look at this. Look, I don't know if you can see
Wow.
it.
Yes, we can
So
see
I
it.
made the back, and then there is
Yes,
this another
yes, you are.
cushion on the back, small.
y-
So I have designed it for my height. So
Can you show
this
one
is
more
Yes,
time,
you are.
Dr. Gulati? Can you show it one
pardon?
more time, please?
Yeah,
Can you
sure.
have a look at your chair one
This
more
is
time,
a new
please?
thing. I don't think this saxophone chair exists in the world. This is the first I have designed. You can see here. You can see here too. This is to keep the saxophone here.
Oh, wow.
Rest it here. There's the back, and then there is this cushion which fills this portion.
Hmm.
It's a soft cushion here, and on top of that there is a small little cushion here. Can you see that? Maybe not.
Yes, we
Can you
can
see
see
that?
that. Oh,
Yeah,
wow,
small
cool.
little cushion. Now this fills at the lower of my back.
Okay.
This supports my back. So, you can design it for your height. Similarly, I've designed an office chair, which Dr. Kanwar might have seen, which is in my office. So, very simple. It doesn't have to be a complex thing. So, these have to be designed to your height because the same
Rashmi,
chair cannot
you,
be right for
Amazing,
everybody.
Dr. Kavar. I'm really
Rashmi,
so happy Dr. Gulati is here and he's sharing with us such an
uh,
amazing information
I
and
did not intend to
we're
show
not
you my
aware.
saxophone chair, but
but
Awesome.
by
Rashmi, Rashmi, did you realize that you just made Dr. Gulati put a strain of 570 kilos on his
no, no, no,
spine
I didn't
I
meant. I
know.
didn't.
by
No, you have
lifting
to.
the chair?
No, 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 no. I sat down a little bit and I picked it.
Yeah, yeah.
That
There
is
is
the
always
thing.
a way to pick up a weight. Yeah, of course, of
And
It
you're
course.
not
should be,
allowed to
it
watch this video. You're not going to watch this video again and find faults.
it should be
Wow.
about 5 kilos, and it actually put 570 kilos on your spine.
But
Okay, so we are
I'm
not
willing.
going to ask you to lift it
No, no, no.
again.
I'm willing to make this sacrifice for my audience. Not a
Ah,
problem.
nice. Thank you so
Great,
much, Dr.
great. That's
Gulati. It's
very
amazing. Like our
appreciated.
viewers are just loving it and they are so happy that it's a great information what you're sharing and this is a great benefit for
Yeah.
because as I told, health is wealth. That is the whole key of good health. You need it's very important actually to live a good life.
So,
Sure.
viewers, while I was checking my knee height while I'm sitting on the chair, I was checking whether my knees were at the same level as my hips. I think they are,
Yeah.
but that may be right now. In the sofa I was sitting earlier, it was not.
No,
So,
it
but
can't.
now I'll take care. Dr. Yash, I'll be taking care of that.
Yeah.
Okay. If somebody develops issues with backache and stuff because of these reasons, postural reasons, and too much of sitting and too much of putting the strain on the back. So, what do you advise them? What kind of exercises? What kind of instructions do you give them?
Look, I mean, one important thing is that there are exercises which one can do in one's office. You don't have to go to a gym. You don't have to go to a physiotherapy center. There are many exercises which you can do by the side of your seat. For example, neck exercises, bending forward, backward, turn like this, turn like that, rotate this, shoulders, shrugs, all these things. And then you can stand, bend forwards a bit, bend backwards a bit, bend side a bit, stretch yourself, stretch your body, stretch your legs, keep your leg on the stool and push your leg down. All these ankle pushes ups and downs and all. These are very easy. This can be done in your office sitting. The secret is that you should not be sitting in your chair continuously for more than half an hour to an hour. You
Okay.
must find a reason to get up and walk a little bit. I often tell my executive friends, you can actually design a kind of a platform on which you can split your work, do it standing, sit down. If you are a boss Walk up to the table of your junior. That will give you an excuse to walk to that table. The junior will feel good, and you will, fulfill your selfish reason of walking.
Yep.
And that way you have to find a reason. And in the morning, evening, wherever you get a chance, go for a walk, go for a swim if you can, and you must go for some sports. You must keep yourself fit, especially people who are white collar workers, and expose yourself to sunlight. Your vitamin D should be good, because low vitamin D again fatigues your muscles and ligaments more rapidly. And if you are low in vitamin, you must supplement it. All these factors you must remember. And also, I like to divide this back and neck pain into a green flag and a red flag pain. See, green flag pain is the one which is mechanical type of pain, which happens long sitting hours or whatever, bad postures, you have pain, and when you lie down, it goes away, and you walk a little bit, it gets better. But the red flag pain is the one which is continuous, which might wake you up at night, which may be associated with fever, which the pain may be going down the leg or going along the arm, or maybe associated with some other symptom. If there is red flag pain, you must consult your doctor immediately. Green flag pain, you can wait, you can do these ergonomic things, you can do your exercises, you can do your stretches, you can look after your furniture. But still, if the pain doesn't go in 4 to 6 weeks time, you still must consult your doctor. And there is no harm spending some time with a physiotherapist or somebody who knows the exercises, to learn the exercises. Or you can go on the net. There are many things available on the net which you can find the exercise. In fact, if you dial my name on YouTube, I have posted a very nice video which went viral during this COVID time. There were about, I think, three or 400,000 people who watched it, because this is just a 3-minute video on back exercises.
Okay.
Similarly, there are things in which there is a description given. I can send you later on, in which I have made cartoons describing how to do exercises, giving detailed instructions. So maybe I can give it to Dr. Kanwar. He will
Yeah,
pass it
sure.
on to you.
Of course.
So these are very simple things which can be done to prevent the. See, if I can give you one word how to prevent this problem, and if I can make people remember one word from this program today, I'll be very happy. And that word is activity.
Yeah.
Must be active. If you can stay active, you can keep this back pain far away from you. There are other causes which are organic causes that we can't help, but these postural causes, and of course, keep your weight in check. I often say, if there's a horse carrying 100 kilos backload and a horse carrying 500 kilo backload, which one is going to get tired faster and which one is going to have pains faster? This doesn't take an orthopedic surgeon to tell you. So weight reduction, weight control, center of gravity goes to the right place, muscles and ligaments will not get fatigued. All these things are extremely. And also, one more thing, heavy smoking has been correlated with back pain.
Oh.
So, people who are heavy smokers, please don't, because smoking is one thing which does no good to any part of the body. So all these factors, if one takes care, back pain can be prevented or controlled to a very large extent. And neck
Now,
pain.
coming to your red flag pains, Dr. Yash, what kind of diseases do you see in your practice which cause red flag
See, red
pains?
flag pain in the context of India or developing countries, you will think of infections, tuberculosis. Even in Western countries, tuberculosis is raising its head, with many people being immunocompromised because of HIV status and other things. So you can never rule that out. And there are brucellosis, other infections. And the other most important cause of red flag pain is some kind of malignancy which may be happening. And anybody above the age of 50, continuous back pain, in my practice, what is my way of thinking and treating patients? When somebody comes, my first questions and asking and talking to him and examining it, I hope I am not missing something sinister like malignancy or infection. That's my first aim when I see a patient. My second aim is, can I do something surgically which will make him better? And can I be sure that will make him better? Or can I do something invasive like injection or something which make him better? If the answer to these three things is no, when I tell the guy, look, you need to watch your back by watching your posture, by doing your exercises, strengthening your weight control. This is, you are your own doctor more than me, and you need yourself more than you need me. So that's the way that's my thought process, and that is, I think, correct, because it has helped me a lot, and because then patients also appreciate, look, yes, there is something wrong that I'm doing. That's why I'm getting the pain. So I must rectify that. So all these things, in talking to your red flag, if there's a red flag pain, then of course you have to be very aggressive. Try and find out whether I'm doing an MRI or PET CT or whatever, blood investigations. Find out what's the cause, and then that problem has to be attacked immediately and when possible.
Well, as you talked about the infectious causes, in India, Pott's disease, the TB of the spine, is still common, and we treat a lot of them. Whether it is Pott's disease, or it is one of the other infections, or it is one of the tumors, and you will agree with me that among the tumors, the secondaries means the tumor is somewhere else in the body, and the tumor spreads to the brain, bone, and liver more commonly in a lot of tumors. And when we talk of bone, spine is one of the areas where the tumor from anywhere in the body can spread and sit there and cause the local symptoms, doctor.
Sometimes
Yes.
you're right. Sometimes the first symptom of malignancy is back pain. You remember our
Yeah,
very dear friend, internist,
yeah,
my
yeah,
class fellow. You remember
yeah,
him, and I won't name him.
yeah, yeah, yeah,
He presented with just pain in the upper back, and and then rest is history. CA lung, and later diagnosed and all that. So
yeah.
you have to be very careful. Continuous pain, unremitting pain, pain and not letting you sleep at night, waking you up at night, and being more than 1 or 2 weeks, see your doctor immediately.
Yeah. And besides the pain, what other things do you tend to get, whether it is Pott's disease or tumor? It's like a loss of sensation or weakness in the
Yeah,
lower
again,
limbs,
I'll again come
paralysis.
back to this
Like,
model. I'll come back to this model again because I like to, a pictorial thing is always better to explain.
Yep.
Inside the spinal column is what we have as spinal cord. That is the connect between our brain and the rest of the body. The
Mhm.
brain tells you to move your finger, and through the spinal cord, the current goes and you move your finger. Now, if there is a destruction of the bone and that material presses on the spinal cord, you can lose power in the lower part of the body or in the hands or arm, depending on where the lesion is. Or there are these nerve coming from in this. Sometimes if there's a slip disc or there's a destruction for whatever reason, if the nerve gets pinched, then the pain may go along the root of that nerve. It's like an electric wire. You fiddle with the switch and the bulb may flicker. So it's the wire, wherever that wire is going. So this kind of pain, which is like a current going down the arm or going down the leg, can happen, or there can be a deficit in the power of the leg or arm. Sometimes we may even lose the power to defecate or to pass urine. So all these things can be pretty nasty if unless they are diagnosed early, unless the problem is nipped in the bud.
like people generally know of sciatica, and
Yeah,
it is all the pressure on the nerve root,
on
and
the
then
nerve.
the pain going down, and
Sciatica
this
is
is
only a symptom. It's a disruption. It's a description of pain. Sciatica is
yeah,
not a disease. Sciatica is like saying I have headache. Headache may be tumor.
yeah,
Headache may be tension. So sciatica is the pain coming from the back going down the leg. It may be because of a
yeah,
disc. It may be because of tumor. It may be because of any cause. So we need to
Oh,
find out. Commonest cause is a slip disc.
yeah.
So we need to find out what the cause is.
Perfect. We have talked quite a bit about the back pains and the spine, and you have so elaborately, so beautifully explained
yes.
with the help of the model and your explanations. Now, let me take you to what you were showing me the other day, the half knee replacement. So please tell us something about
All
that.
right. Again, I have a model for you. Let's first understand how the knee joint looks like.
Mhm.
Is it visible?
Yeah.
See,
If
knee,
you take it a little distant, from the camera, it will
Yeah, yeah,
look
we
better.
can see.
Yeah. Okay.
Perfect. Yeah.
Okay.
All right.
Yeah.
Now,
Yeah.
see, this is the bone, the thigh bone. This is the leg bone, and there is an articulation between the two, and this is covered with a very fine cartilage known as the articular cartilage. The friction between this bone and this bone is less than the friction when you move a block of ice on another block of ice.
Mm-hmm.
So it is such a beautifully designed structure which God made for us. But there is a time limit to that. There's a shelf life to this cartilage, which can be short in some people and it may last a lifelong lifetime in
Sure.
some people. Why that is so, we don't know. Overweight, heavy smoking, and old previous injury, and some other factors can make this cartilage a little weak and cause arthritis. There are genetic factors also. If we were to lose this cartilage and the bone was to come moving on another bone, it will become painful, what is known as an arthritis. Similarly, there are other type of arthritis like rheumatoid arthritis, what we call inflammatory type of arthritis. So we'll not talk about that. We're talking about the age-related arthritis. Now, in the beginning, this arthritis can be treated by some simple painkillers, some other pills which are available for cartilage these days, by weight reduction. I gave you the example of a horse, that's true here also, by strengthening the muscles around the joint. Because again, I give the example, if suppose the wall of a room is a little weak, and if we make the pillars strong, the wall will stay, the roof will stay.
Yeah.
So our pillars are our muscles.
Yeah.
If we can make our muscles strong, it will support the joint. So rather than the forcing going into the joint, the muscles will absorb the forces. I give the example of footballers, the soccer player. They keep hitting the ball with their head. If the stress was going to our spine or the disc, it would go. The fact of the matter is that their muscles are so strong, the whole impact is absorbed by the muscle. It doesn't go to the bones inside. Similarly, if we can strengthen our muscles, it will take the strain. Now, suppose we have done all this and still it doesn't work. And if the joint is destroyed to an extent that is an end stage arthritis, then we have to do what is known as a joint replacement. A total knee replacement is the commonest operation done
Yeah.
in the West or in our country. But there is another type of arthritis which has been recognized in about 30% of cases who undergo total knee replacement. Actually, they don't need total knee replacement. Because in those cases, only one part of the joint, which is either the inner side or the outer side, is involved. The rest of the joint is pretty good. And there are ways to find out by doing special x-rays and by clinical examination to find out whether that is the case. If that is the case, then we don't need to change the whole joint. I'll give you show you the model, how the total joint replacement looks like. Here it is. See, this is the total joint which has been changed. I'll open this and show you. This is a kind of a new cover which is put on top of the joint. See,
Oh, okay.
like this.
Okay.
Right. So this the bone is shaped and you put it on top of that so that the painful surface of the joint is covered by this particular metal and a plastic below. Now this is, we are changing the whole joint. Now if the whole joint is not spoiled, why do we have to do such a big operation?
Yeah.
So what then I do here is, which has been very useful and very good result, because you are not touching all this joint.
Yeah.
What you're doing is only changing this part of the joint. Can
Oh,
you see that?
interesting. Very nice. Mm-hmm. Yeah.
See?
Yeah.
Only this part of the joint, what is known as a partial joint replacement. So this, and with this joint replacement, you can squat. A Muslim can pray kneeling on his knee. An Indian can sit cross-legged. You can walk, you can jog, you can play light tennis, and this will last as long as the other joint. So this is a fantastic operation, and we are very happy that we have introduced this, and the results are very nice. So we need to recognize this. There was some reservation about this surgery being recognized in US, but now FDA approves this, and FDA has approved a couple of companies' implants for this partial knee replacement, and a very good result. In the UK now, almost 30% of joint replacement in the knee are now this partial or half knee replacement. And in India, unfortunately, many people are not trained in that, so it's not yet that popular. But in my practice, about 30% of knees I do is partial knee, and the results are very good.
Yeah, tell me one thing. With this partial knee replacement, uh, have you come across cases where the the stress on the other half of the joint has increased and has led on to a faster deterioration of that part, and then eventually you had to think that you may have to do a similar operation on the other side also?
I'm so jealous of you. You started thinking like an orthopedic surgeon now, Dr. Kanwar.
No, I'm just. This also means that I'm listening to you very intently.
Of course, everybody is very much
No, but
like
that is true.
taking
See,
out
that is
time.
true.
Actually, people have started texting me non-stop that they are planning to visit Dr. Kulati when they are visiting India. They are definitely gonna
No,
meet him
that is
now.
well, sure, more than welcome. Or they can talk to me through the mail or whatever. That's not a problem. I can give them advice. They don't have to come all the way. And the thing is, Dr. Kanwar, that where were we about?
About the second half, which is not touched,
True.
could that
The thing is,
get
you see,
deteriorated?
that is what I said, that there are some special X-rays, stress X-rays to be done to see whether the other part of the joint is okay or not, and then to see whether the ligaments are intact or not. And every time we do this partial or half knee replacement, we take a consent of partial oblique total knee replacement. When we open this through a mini incision, we inspect the rest of the joint. And if we find that that is not okay, then we'll proceed with total knee. This has happened to me once or twice in my lifetime, because other investigations are now so good, and with experience, we can make out that the rest of the joint is okay. And another important thing is not to overstuff the side that we are replacing. We have to leave it a little loose. Now that's a technical thing, that if we push it too much, then the stress will go on the other side of the joint. So your observation is absolutely correct, but then there are ways to not do that. So two things. One is to make sure that that particular rest of the joint was okay. Secondly, technically, we must not overload this side so that the weight is not transferred to the other side. So there has to be a little wee bit of under correction so that the outer side of the joint is not exposed to this extra weight bearing. But a very good question, Dr. Kanwar. I'm impressed with your question.
Oh my God. Oh well, Dr. Yash, it's been such a pleasure having you across and getting all the information from you. And this is going to be so helpful to the audience. And these are common old age problems, and
Sure.
people need to understand what is happening and need to understand also. I mean, how to go about it, at what stage. There is nothing else except a surgery, when all other options fail. Yeah, please, you were going to say
No, I
something?
just wanted to make a point that this particular partial or half knee replacement is actually very good for relatively younger people also,
Oh,
because we are not destroying the whole of the bone stock. So in fact, this is the best option for the two ends of the spectrum, relatively young and very old. Because in very old, you don't want to, do too much of a surgery and give the relief. In very young, you don't want to do away with whatever good joint you have. So in fact, in relatively younger people, it's a very good option. In fact, most of my patients who had partial knee are around 50, 55, 60. So because that's where otherwise the disease will advance to involve the whole of the joint.
yeah, our viewer wanted to know
But too
about
long.
the what age limit should be, and that's a wonderful answer you've given.
If you leave
Actually,
it
it's
for
a
too
good
long, then
information
rest
for
of the
them.
joint will get involved.
Great. So, is there anything important we should add in our diet, like every day, today, or I do have few questions about calcium. Like, is it important to eat calcium after 50? I would like to know answers for these few questions.
Actually, Dr. Kamar will be a better person to tell, but I am the guest, so I will answer. Yeah, as far as diet is concerned, I take Dr. Kamar's help many times. When I give TB treatment and they are having problem with their liver, some of these drugs are toxic, and then I go running to him. Well, what next? What drug to give now? Because we I often say I'm only a carpenter. These guys are doctors. So we have to take care. So yeah, about the diet, one has to take balanced diet.
Yeah.
All this fad about high protein, pure protein diet, keto diet, and this diet
Yeah.
and that diet. I think it's better to take, because everything is important. Carbs are important, fat is important, and protein is important. Vitamins are important, minerals are important. Anything that is
Yes.
deficient will cause problems. There's a percentage of everything that is required. People who go on high keto diets, they have, many of them have many other medical issues which develop. So one has to be very careful. So take balanced diet, do good exercise, be active, make sure that your BMI is under control, and activity. If you do that, it's fine. Because even if you
Perfect.
overeat a little bit, you'll be able to kind of burn it. And no smoking. Because smoking, my dad used to tell me, if you want to take a revenge from an enemy, teach him how to smoke, and you're done. So it's a bad thing to smoke. And
So
alcohol, again, some people say that little alcohol is helpful, but now the scientific data is coming that even little amount of alcohol is not okay.
Yeah.
But that's another subject. I mean, I don't want to go into that, because some people may get very offended. Why am I saying don't know alcohol? So that's a different subject.
lovely, lovely chatting with you, Dr. Yash. Rashmi, it's been very illustrating, and very, eye-opening talk, where the audience is certainly going to be a lot benefited by the common things: backache, knee replacement for older people.
Yeah.
These things I wanted to cover, and thanks to Dr. Gulati, who came over today. Rashmi, you have any questions?
Actually, I would like to say, Dr. Gulati, you will have to come one more time because there are a lot of questions, not few questions. So, Dr. Kanwar, we
Yeah,
need to have one more
yeah.
session with him.
Here's
It
the
will be
cost.
a live talk
Here's
with
the
our
cost. Let's ask
viewers.
it.
Yeah, because they want to ask him a lot of questions. So it's better, I think
Sure.
so. Let's have one more session with Dr. Gulati, and our viewers can definitely call and talk to him. That will be great,
No
Sure.
problem.
actually.
We'll,
It'll be a
we'll do
pleasure.
that. We'll do that.
Done.
We'll do that.
Pleasure.
Thank you very much, Dr. Yash.
Thank
And
you
it's been a
so much,
pleasure having
Dr.
you here.
Gulati. It was a
And
very
thank you,
informative
Rashmi.
session, actually.
Thank you. Thank you.
Yeah,
It comes from the
yeah,
heart. That's why.
yeah, yeah. I could see it coming from the heart. Anyway, all the way through.
But in such a short time, you have given so much of information, and this is going to be a great benefit for everyone, trust me. And it's a day to
And
day
I'm very
problem.
happy.
That's what you're talking. So, thank
I'm
you so
happy
much,
today.
Dr. Gulati, and thank you, Dr. Cover. It was great having both of you on our show today, and looking forward for part two with Dr. Gulati.
Thank you.
Thank you.
Thank you, Dr.
We
Gulati.
will
Thank you
have it.
so much for
Thank
your time.
Have a
Thanks.
good day. Have a good day. Thanks, Dr. Kamar. Thank you.
Thank you.
God
you.
bless.